Should be just a second. And go ahead.
Hi there, and welcome back to another edition of our COVID-19 weekly update with Manfred Green, Director of University of Haifa's International Master's Program in Public Health and Global Health Leadership, hosted, of course, by the American Society of the University of Haifa. There's been a lot of news since our last conversation with you, Dr. Green. Israel continues their full national lockdown. President Trump caught COVID-19, and additional information is coming out about a potential vaccine and the long-term effects of this virus. So Dr. Green, let's get to it. Israel is entering week 3 of their full national lockdown. Curious to know what you're seeing in the most recent numbers and analysis, and if there's any room at this point for optimism.
Yeah, I think every country is unique, but Israel has its own peculiar characteristics. There's been obviously a very big increase in cases, but if you look at the breakdown of the cases, a large percentage are young people. I think it's about 30% are under the age of 20. And if you go even up to the age of 30, you'll probably find that 40% or more of the cases, or maybe more, which is unusual because that's not the typical breakdown in other countries. And that's related largely, I guess, to the behavior of the population and the different segments of the population, who to some extent or to a large extent have been ignoring or breaking the regulations. And we go back again to the simplest message which we've spoken about, which, as I say, we say was so simple. Why are we not managing? And that is to wear masks, to not to go to gatherings, and to make sure that there's social distancing. And that's obviously not being carried out. We can see that that's happening in different segments of the society. So whether it's going to be weddings or celebrations, or young people having fun, or religious groups who are praying together or learning together, these are places where the virus spreads very easily. And that's how the virus spreads in these, it's easy to spread in large gatherings. So unless we can get that under control, we're not really going to get the numbers down. The other interesting feature is that we are seeing an increase in severe cases, but according to the numbers, it probably should have been much more than what we're seeing, and probably because the age of the cases is low and the disease is generally not that serious in young people. There are cases, obviously, but on the whole, it's a lot less serious in young people. So we get a little bit of this paradox. If you look at our numbers anywhere on the internet, you say, wow, we've got a lot of cases, but we don't seem to have proportionally that many deaths or severe cases. And that's very much a function of the age distribution of the cases.
Mm-hmm. Just a follow up to that, I read today that, there's already ministers, there's been a slight drop in tests, and I believe an infection rate in Israel. There's already ministers calling for an easement of the lockdown. I assume that the leadership of the Israeli government will be much more careful this time around than the last lockdown. Just how careful do you think they're going to be before they start to ease society back into to normality?
Right. I think that my main message would be to be proactive and not reactive. In other words, don't just look at the numbers and then the next day introduce new regulations, either putting in more restrictions or lowering the restrictions. It should be on a very gradual basis. And also reduce the restrictions on a rational basis. There's some of the restrictions I would consider really of borderline evidence that they're doing anything. Now, let me give you just a couple of examples. People taking away from a restaurant. Why should you limit takeaways from restaurants if in fact you can make sure, and I think you can still educate the public. As I said, it's not, if you have a takeaway place, you stand in line outside, you stand a meter apart, and you wear a mask, and a couple of people go in. So that should be an easy restriction to eliminate. And there could be going out into the park or going for walks. or cycling. And the distance from your house probably shouldn't make any difference as long as you're not congregating. So those are restrictions, I think, that could be lifted fairly easily. There are a couple of areas that are going to be more problematic. One is obviously the educational system, and there's this debate about whether the kids are spreading or not. But I think, just from a logical point of view, we all agree that it's better that the children be in school. I mean, it's not a discussion. People often introduce this as the main point. Well, that main point, I think everybody agrees on. There must be hardly anyone. The question really is, how much is that contributing to spread, and what is the cost? So if you look at our numbers again, you are basically seeing, and I think people are not aware of it, you're basically seeing numbers running into the thousands of little kids with COVID. I mean, it's maybe 1,050 under the age of 10. So it's not something that doesn't occur. It's occurring. How much that's going into the community is still being debated, and it looks like it according to the curves. You're going to come back at me and say, but it's good to have the kids in school. I'm going back again to the thing. That's not the point. That we agree on. The question is, what is it going to do? So I would say, let's see how we can bring the young kids back into school, certainly the primary school, and grade school or whatever you call it, and then make sure that they are kept there. So in other words, keep the class sizes very small, stagger the times, maybe have morning sessions and afternoon sessions, have kids playing outside much more, much less inside, or even being, and I think that you need a lot more, shall we say, teaching or teaching assistants to come in and help. And that I would expand very dramatically. So that I think would be my first. The other, of course, would be the problems of things like places of entertainment and restaurants, which are a lot more problematic. But again, as I said, we have to think creatively. Maybe if we have some time, we can give some suggestions to the entertainers of how to entertain outside with a perspex screen in front of them and the people, wearing masks, and maybe we can do that.
I think a lot of entertainers could be after some good suggestions about how they could perform in front of large crowds again.
Right. I'm actually, by the way, I'm surprised there are no new ideas on that. But anyway, we'll talk about that another time.
Yeah, another discussion.
Another startup. Yeah.
Yeah. Just going back, staying on Israel for a minute. Last week, it was reported Israel had 3 times the infection rate of other countries around the world. I know you said, a lot more young people are getting this virus, but it seems like 3 times any other country is just drastic numbers. Is it in Israel? Is it a matter of the demographics and just the population, which makes it so hard for Israel to control this pandemic?
Yeah, I think it's the manner of the spread particularly. And that's why I think we should be focusing very much our energies on that. And that is these clusters, big clusters. So these are these big events. So while in many countries you may find small groups that are being infected, 2, 3, 4, and family and so on, in Israel you're having 100, 200, 300 people being infected, doing things that they shouldn't do and congregating. So that creates these big clusters. So, it's pretty much where you may say that what is equivalent to 10 cases in one country might be 100 in our country, or in Israel, basically because it was the same time. It was an event with different numbers. So you might have a small gathering of celebration of 10 in Norway or wherever, and it would be 100 or 200 in Israel. So proportionately, at the same event, same type of event, you'd have this large number of things. So I think that balloons up. And again, I stress, and looking at many of them are young people. So that increases it. These are, the one last point is that if you look at the data, it's not a surprise that elderly people generally don't congregate largely. I mean, their meetings are in much smaller groups. Young people tend to gather in much larger groups. So this is really going to make a difference.
Right. Dr. Green, the big news last week was the diagnosis of President Trump, who's been receiving treatment for a few days now, Walter Reed Medical Center. Reports are that he could be released from the hospital as early as today, Monday. Yesterday, the president briefly did leave the hospital for what appeared to be a car ride to greet supporters. I think a lot of people still have a lot of questions about the president and the COVID diagnosis. Based on what you're hearing from his doctors and his medical staff over the past few days, what is your evaluation of the situation, reading between the lines?
Well, let me just start with the incident itself. And again, I'm giving you this information based on what I see in the media. So it's not official stuff, and it may be some of it is not correct. But according to the media and what I've seen, it looks as if, and the way in which it's occurred with a number of people being infected around the president, it does seem to have been a kind of what we would call common source. It occurred at a single event, or that's what it looks like. And obviously the one event that's been singled out is the nomination event that was an announcement. And I know there's a picture even in Time or wherever it is actually indicating the way people were sitting and who got infected. Yeah. And the other thing was who was wearing a mask and who wasn't wearing a mask. And it brings us back again, this is a classical example. And again, even if the facts are not entirely correct, I'm not, someone will come to me and how do you know? Let's assume that it's not 100% sure, but it makes sense. This is classic example of spread of COVID. People sitting together in a crowded gathering without masks. I mean, it's just like, if the COVID virus wanted to speak, they would probably come to you and say, we want to organize an event, a party to spread out, to just spread the virus. Organize an event where a lot of people sit together without masks. That's it. So it's not complicated to see the possibility of that happening. And I think it just goes back again and says, that's what we're going to have to be doing for the next few months. There's no other way. And that's actually the most convenient way. What we need to do is to find out the ways in which we reduce that and still live normal lives. The question, your second question was regarding the diagnosis and disease and so on. The diagnosis often can take some time. You don't necessarily, as you know, people can be asymptomatic with a positive diagnosis, but they can have a negative diagnosis early on in the disease. So it really depends on a number of factors of how the swabs are taken and how much virus there is and so on. So this can be a little bit confusing in the beginning. And then, of course, we would go over to the treatment because you would argue that the treatment that the president getting may be, in terms of what was announced as being very much a virtually asymptomatic infection, the initial, he was getting relatively advanced treatment. I mean, he was already getting oxygen and dexamethasone, at least that's what's been reported, and antiviral therapy, and even as the treatment that is still being tested. It's on clinical trials still. So that, so then you'd say to yourself, well, okay, that's the president. But the presidents in history, if you go back, the kings and the presidents going back 100, 200 years ago, they may have been overtreated. In fact, the treatment might have actually done them more damage than anything else. So you have to be very careful as to whether, the high profile people sometimes get overtreated. But I'm not saying this is happening now, but I'm saying that he certainly seemed to get the heavy guns early on, which may be the right thing to do, but that's what he got. That wouldn't, it doesn't look like the run of the mill sort of stuff.
Right. Reports and rumors continue to swirl about the long-term effects of COVID, even from those who are asymptomatic. They might suffer down the line from heart or lung irregularities. Is this serious cause for concern in the more research that you continue to read about it? And is it grossly different than other long-term effects that a percentage of the population might see from viral infections?
Okay, we're actually planning a study on this, and we hope to start quite soon. You're quite right. First of all, let's start with the end and say, do you see it with other viral? Classically, it's said that with influenza, there is a period of time after the disease where people don't feel well. They feel tired and they feel a little, sort of, so we say a little depressed, under the weather, so to speak. So classically, you do hear that a percentage of people after influenza, after real influenza, they do have this kind of after effect. And of course, there are other diseases which have more severe after effects, but in COVID, there is evidence now that people do have, shall we say, lingering effects. They're not necessarily the long-term severe ones. So they will continue to feel tired, they'll continue to cough. And there are some classic descriptions of this, which may go on for a long time, a month more. And we believe probably much more for some, for a small number. Whether there's a long-term effect and how common is it is still being studied. But as you know, they're looking into the effect. The virus does affect multiple systems. It's different from influenza, which primarily affects the respiratory system. But the COVID virus is going just about virtually everywhere in the body. It's affecting the heart. There's encephalitis. There's all kinds of other side effects that you're seeing, certainly lung effects, so respiratory ones. So we have to be concerned that they are. If this may well be more in the people who've had the more severe form of the disease, but we always have to add that that's not always the case, that you may have a relatively mild form of the disease, but continue to have a long-term symptom. What are the reasons for it? It's not clear. It's part of it, obviously, is the actual disease process during the disease. And we're still basically learning about that.
Mm-hmm. In research that you've recently conducted, but have yet to publish, you cited that social media misinformation is a considerable threat to vaccine acceptability. And according to recent evidence, only 30% of people in countries that were surveyed want to receive a vaccine as soon as it becomes available. So we know increased communication is crucial for the vaccine and for COVID all the way around. But in terms of a vaccine in today's world, how can we make sure the information that we are receiving is accurate and trustworthy information?
I think that we need to start working now. In other words, it's not something that we need to wait to do. And we need to educate the public as to what is the process that a vaccine undergoes in order to develop it, so that people are understanding clearly what is the development process. And I'll just give two examples here. A new vaccine for a new drug, a new disease, is different from one that we're already familiar with, like influenza and so on. So for the influenza vaccine, every year or every couple of years, there's a new formulation of the influenza vaccine. And it's a kind of a new vaccine, but it's not really entirely new. Sorry, so the technology is very similar, and you develop this new vaccine. And that undergoes very limited testing, because you actually, what happens is when the Northern Hemisphere learns what's going on in the Southern Hemisphere, picks up that virus strain, and then uses that to develop the vaccine. So you usually have about 6 months to develop the new vaccine, but it's using old technology with a well-known virus. So in fact, here we're talking about a virus that we're not familiar with, or we're just learning about it now. It's from a family that we're familiar with. And vaccines had been started on the SARS virus in 2003, so it's not entirely new, and it's a very closely related virus. But it's still a fairly new, it is a new virus. So we have to make sure it's going through a very solid process of development and testing. And again, I guess it's not strange that if I asked you what kind of vaccine would you prefer, very safe or very effective, I would guess you would probably say very safe first of all, and then very effective. I mean, the safety is probably of more importance to people than anything. And then comes the efficacy. So we have to make sure that the public recognizes and gets information that's valid information. This vaccine has gone through very strict testing procedures for the safety of the vaccine. Mm. And so this would, not only is it just in the way it's tested, but the way it's produced. So we know it means that we understand the technology. It's a technology which ensures that this is not something that is likely to cause disease in anyone, or side effects, and then that's tested. And at the same time, obviously, you'd want to know that it's effective. So that's going to be, I think, not an easy task, because people in recent years have become suspicious sometimes of vaccine. which they shouldn't be, in my opinion, because vaccines are they're certainly much safer than anything else that we're using to treat disease. But they pretty, anyway. And I would add the last thing, I've been at a meeting recently where I actually said that if you ask me now, would I take the vaccine? I'd say not only would I accept it, I would enter one of the trials. So if any of the people who are conducting clinical trials are hearing me, I'm available as a volunteer.
Doctor, are you surprised at all by that 30% stat, just given the impact that COVID has had on people's lives over the past 8 months and how it seems to be perhaps, you know, the way we get out of this? Are you surprised that 30% of the people in countries that were surveyed would want to receive this vaccine soon, based on your history? Is that a surprising figure to you?
I think there are two factors. How dangerous does the disease seem to the individual? So, you know, we're giving statistics. So if I ask you, it would depend very much, again, on your age and whatever. So if I'm going to say to you, okay, so you're a young person and you don't have any morbidity, you don't have underlying conditions, you'd say, well, you know what? It's not that essential for me. And this is what people say often about the flu vaccine. The other is a very common and I guess understandable thing. Let somebody else get it first and let's see what happens. So I think that that's part of it as well, is that this is kind of wait and see. We want to know that it's been in use long enough for us to be able to evaluate whether in fact it's really safe and effective. You know, it's virtually like buying a new car or whatever. You want to first see that it's been on the road and other people have used it. But somebody has to be this first one.
Right.
So we have to make sure. But in this case, as you say, I guess that's what's describing the reluctance of a fairly large percentage of the population to receive it. The question, though, is whether they will then be able, let's say in the first month or two, they may not want to get it in the first batch. How long is it going to take them to say they are prepared to get it? And how many resistors are there going to be who are going to say that under no conditions will they take it? And that's going to affect, obviously, the impact of the vaccine on the population. We need at least 60% or so uptake of the vaccine for it to really have a population effect, 60, 70%. That's my evaluation. So hopefully that'll be.
Yeah, fascinating. It looks like that's all the time we have for today, Dr. Green. Thank you so much for speaking with us. As always, to our audience, if you have any questions for Dr. Green, please do leave them in the comments section of this video or email them to info@asuh.org and we'll make sure they get answered. For more information on the university's work around the pandemic and to support the University of Haifa during this time, please find a link included in this post. Thank you all for tuning in and please stay safe.
Thank you, Jake.